Welcome back to Technique Tuesday. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today we're going over a few things that will really help with people who have frozen shoulder or adhesive capsulitis. And you'll know this when you have a hard time reaching behind your back, tuck in your shirt, reach for your wallet, put your belt on, or overhead to the side where it starts to get really stiff and tight. Today I'm going to show you an exercise that's really going to help with both of those movements so you can improve your ability to reach in the back seat, tuck your shirt in, and otherwise live a healthy, active lifestyle. Okay, all you're going to need at home is dog leash, beach towel, bed sheet, anything that has some length to it. This is the bad shoulder, and all you're going to do is flip this around, reach underneath, from underneath the shoulder, so it's going to go under the armpit, and then just going to go around the head, neck, and shoulder area. Stay big and tall. Don't allow this to slouch or pull you down, but stay big and tall. And then what you're going to do is he's going to pull his arm downward and squeeze and hold 3 to 5 seconds. Inhale, exhale, and then relax and come back out. We're going to repeat this 15 to 20 times. Holding down here at the bottom, 3 to 5 seconds, inhale, exhale, and then relax and come back up. Again, 15 to 20 times, as long as you need. What you're going to notice is this is going to tighten up the strap and really stabilize the shoulder. So as you go into this, it keeps the motion of internal rotation pure, so we get no compensation from the shoulder blade that comes around and will hide some of the stiffness that you have with internal rotation. This keeps it very pure in the glenohumeral joint, which is the arm bone sitting into the joint socket. As he does this, we're activating and working all the muscles of internal rotation so they get stronger through that movement. And that's one of the things that we see break down with adhesive capsulitis that needs a bunch of attention that's often hard to get. This is really going to help with your ability to reach behind you, get into your back pocket, tuck in your shirt, put a belt on, all the things that you need to be able to reach behind you for. Again, doing this 3 to 5 seconds, repeating 15 to 20 times. Things to note, we don't want this to pull down where he gets slouchy through his trunk, looking down. He stays big and tall, active. If you can't get to 90, that's fine. Settle here, and you're going to pull in. The biggest thing is keep your elbow at 90 degrees. Sometimes we'll see folks who will come and straighten out their elbow. We don't want to straighten the elbow. Keep that elbow bent here at 90. The strap's going to stay right underneath the shoulder, under the armpit, as he comes here. If he can't quite get into those positions, we're okay to come out to here. We just want to be able to find a spot as high up as we can and as high back as we can, so we get as close to 90-90 of the shoulder and elbow as possible. All right, I hope that helped. Adhesive capsulitis is a very common thing happening to people over the age of 45 on up to 65. It often happens after you've had some kind of shoulder injury, whether it's simple. Maybe you reached for something or pulled or grabbed something and there's a little bit of a yank or a jerk to your shoulder. Maybe it didn't hurt all that bad at the time, but you're noticing as the weeks and months go on, it's starting to get stiffer and stiffer. Adhesive capsulitis is something that we can manage, and it is really a result of a shoulder injury that didn't get managed properly early on. And so it's highly avoidable, but once it starts to happen, it's hugely important that you work to mobilize and improve the motion of your shoulder so that those changes don't become permanent. If you find yourself suffering from some stiffness in your shoulder, try this out. Let us know if it helped for you and what other questions you have in the comments below. We'd love to help.